I think the first and most important thing I would emphasize is that every patient will get a detailed preoperative visit with myself and my staff. They will be given a packet with frequently asked questions and their answers, as well as specific instructions. Other things that will be given to them at that time include their prescriptions, which we encourage the patient to fill before arriving at the surgery center. Other specific instructions include: each of the preoperative instructions has an important purpose. You should get a printed form of some of these instructions at the time of your pre-op visit. First, do not eat or drink anything starting at midnight the night before surgery unless otherwise specified. It is wise not to have any heavy meals the night before surgery, and please abstain from any alcohol intake for 3 days prior to surgery. It is very important that you bring all your medications that you are currently taking to the surgery center or hospital on the day of surgery. The nurses will review these meds and your prescription meds given for surgery. Please bring your driver's license. When you arrive, you should wear a house coat, a muumuu, or a robe with an opening to the front on the day of surgery. Please do not wear any pants, particularly if you're having a tummy tuck. It is very important that you do not wear any makeup, deodorant, lotions, and in particular, please have no acrylic nails on the day of surgery. If you happen to have these nails, please have them removed prior to surgery. Do not shave or wax for 2 weeks prior to surgery if an incision is to be placed in that hair-bearing region. For our overnight stays at the surgery center, it's important for you to realize that you will be picked up 7:30 a.m. the next day, and family members are not allowed to stay overnight. Medications to stop prior to surgery include fish oils, Advil, aspirin, and phentermine. A complete list of additional medications to avoid is also listed in your preoperative packet. These medications can react with our anesthetics or increase the likelihood of high blood pressure, wound problems, or bleeding. Probably one of the most important things that patients need to realize is there should be no smoking 3 weeks before and 3 weeks after surgery. Nicotine in any form, including dips or chews or electronic cigarettes, will inhibit wound healing. This is a very important consideration. Next, avoid strenuous activity or weightlifting 2 weeks prior to surgery. It's important that you do not remove or change any dressings unless instructed by Dr. Rumalla. Some of the activity restrictions you should be prepared for include: for tummy tucks, that you need to sleep in a recliner or a comfortable chair for 2 weeks following surgery, and there is to be no climbing of stairs, so plan out your life to be on the first level. When standing or walking, it's important that patients who had a tummy tuck, for example, remain in a hunched over position for at least a week or until instructed by Dr. Rumalla. For breast procedures, these patients are also encouraged to sleep in a recliner or comfortable chair for at least 1 week following surgery. With all breast surgeries, it is very important not to lift your arms above the waist and keep your arms at your side until further instructed. When you are going home, if you've had a breast procedure, you will be wrapped up in an ACE. If you've had body contouring procedures like tummy tucks or liposuction, you may have a binder or girdle as needed. It is important you do not resume any post-operative exercises until further instructed by Dr. Rumalla. If you've had a procedure that involves drains, these drains need to be emptied and the fluid measured 3 times per day. Please document the amount of drainage on the drain sheet provided at the surgery center. Drains need to be on suction at all times. In terms of ice, breast augmentations, reductions, and lifts may have ice applied to the breast for 2 days after surgery. This ice is placed for 20 minutes on and then 40 minutes off. Patients who are having contouring should not place ice on their liposuction or their tummy tuck. Returning to work depends on the activity level required at work. Most people can be back at a desk job after breast or tummy procedures after a week. However, no travel away from the local area is allowed for typically 3 weeks. Additional instructions include that patients are not to have submerged baths, go into hot tubs, or swim for at least 6 weeks. Patients are not allowed to drive while they're taking narcotics. In terms of scar management, patients are not to start any over-the-counter or other scar management products until instructed by Dr. Rumalla. Finally, it's important to realize that your surgical recovery may be altered and customized on an individual basis. You will get precise instructions and details at your frequent follow-up visits. Closely following your pre- and post-operative instructions and close supervision by myself and my staff are crucial to getting the best result.